We are joined by our final special guest of the morning from Barnabas Health Medical Group on Columbia Turnpike in Florham Park, and that's Dr. Su Wang. She's a board-certified internist and the medical director for the Center for Asian Health at St. Barnabas Medical Center. She previously was an epidemic intelligence officer, service officer for the Centers for Disease Control and Prevention, and an executive board member for the World Hepatitis Alliance and a co-chair of the New Jersey Hepatitis B Coalition. And Doctor, first off, you are here kind of to talk about liver health and what people can get done here at the center, and talk a bit why liver health is important to us all.
Sure. Thanks for having me. The liver is one of the most important organs in your body. It creates all the proteins that are important for nutrition, digestion, and for even blood clotting. And your liver health is extremely important, and it is very much impacted by your own lifestyle. So in terms of what you eat, alcohol intake, as we all know, too much alcohol can lead to cirrhosis. But also what we're finding more of is even diet, exercise, being overweight can impact your liver. And one of the most important things that are happening nowadays is that fatty liver is the number one leading cause of liver transplants. So this is something that we kind of didn't expect. Before it was cirrhosis from alcohol, Hep B and Hep C, and now we're seeing rapidly growing fatty liver as a cause of liver transplantation. And that is because of our diet and our lack of exercise and being overweight. And there's no real quick fix for it. There's no medication. It really is all about maintaining a healthy lifestyle. So we're here. This is what we do. We try to keep people healthy. As an internist, I see this every single day. Actually, even in perfectly thin people with not great diets, I see fatty liver. And so our job as internists is to see you. We work on together maintaining a healthy lifestyle. And Barnabas Health has a lot of specialists also to keep people healthy.
Yeah, that's the great thing about a facility like this is your connection and your complete affiliation with St. Barnabas, which has just so many experts in so many fields that whatever you diagnose here,
yep, whatever specialist you need, whatever service you need, diagnostic, whatever radiology you need, we can get you to the right place.
Yeah. So fatty liver, I mean, that's something that's not really age dependent. You can probably see this in younger patients.
I see this in 20-year-olds that are perfectly healthy. And a lot of it is just the Western lifestyle, the fact that we're more sedentary, and we all have such great foods that are, accessible. So.
And not such great foods. So.
Right. It's an abundance of food.
Yeah, really. So, it is both. And let's talk about, the need for that healthy lifestyle, as you talked about, to maintain liver health. What people have really got to kind of focus in on.
Yeah, so what we're finding is that this is multifactorial. So there's a combination of conditions that are leading to what we call the metabolic syndrome. So if you have an abdominal girth over 40 inches, if your doctor's told you have pre-diabetes or impaired fasting glucose, so your insulin's not working so great, your blood sugars are a little high, not diabetic, but just a little bit high, plus you have high triglycerides, maybe some other cholesterol panel abnormalities. This is causing what we call metabolic syndrome, which all feeds into each other and can lead to fatty liver as part of this whole thing. So, and the hardest part is that it requires lifestyle change. There's no medication I can give you just to make it all go away. And this is the hardest thing, but I've had patients who they're really committed to it. Over 3 months, they'll lose 20 pounds, and I'll see all these numbers go better. I'll see the LFTs, the liver function tests go down. I'll see their hypertension go away. And some of these patients, I say, I need to have you talk to other people, because sometimes people just can't imagine that they can actually do it. But if you put your mind to it, and I have people who can't even exercise because their knees hurt, but they change their diet, and that alone, they cut out their snacks, or they cut down the rice. I mean, for a lot of people, it's like the carb intake, and they really put their mind to it. It's amazing what you can actually do.
It's just doing it and sticking to it. That's the main thing.
It is, and there are studies that show there's not one diet that works better than the other in terms of Atkins, South Beach diet. It's the fact that as long as you follow that diet, that's when it actually works.
All right. Dr. Wang, you were saying, and I mentioned in your introduction, that you are the director for the Center for Asian Health at St. Barnabas Medical Center. Very interesting to me. Let's find out more about that.
Yeah, so one of the things that we believe in is that you have to really serve the population and know the population that's in your community. And so what we know about New Jersey is that we have the 4th largest Asian population in the U.S. We're very diverse. We have more Asians than the state of Hawaii. And we find that there's certain things that could be barriers to health, so language, culture. And so our goal is not just to expect everybody to come to us, but we go to where people are and we reach them based on what their health issues are. So one of our big medical issues of interest is hepatitis B because it's common in Asians, actually common in the world. It's the most common bloodborne disease in the world. And so we do a lot of screenings, and our whole goal is to keep people healthy because people can have perfectly healthy lives with hepatitis and prevent them from having liver disease. So yes, that's what we're here for. Not just that, we do primary care, so we do everything.
A variety of things, everything that's needed. And people can get in touch with you through here, the facility in Florham Park, or at St. Barnabas in general, or how do they go about it?
So we're here. You can search us on the web. Our phone number is 973-261-9077.
Terrific. Dr. Su Wang, thank you very much for being with us on the show this morning.
Thanks for having me. It was a pleasure.